Hi guys, welcome back. So we had another great case for you guys. And this is just kind of a way for us to show what we do as Gonstead chiropractors. So this patient here is going to tell you why she came to me, what she was dealing with, and the results that she got. So if you like, just tell them why you came.
Sure. I have been having migraines multiple times a month. I have pain in my right elbow, my right knee, severe constipation, and I even went to my primary care physician and just wanted me to do pharmaceuticals, and I don't want to do that. So I decided to come here, and so far, like, everything has been improving. Let's see.
The constipation is gone, right?
Constipation is gone, yes.
Yeah, go ahead.
I was going to say, as you were initially checking my back, every mark that you made on my back, I was thinking, yes, that's what hurts. Yes, that's. And you found every spot in my back. My middle back would hurt, and my lower back would hurt, and so you were able to mark every spot without me saying that's what hurts.
Yeah, so in Gonstead, we do an exam every single time we see a patient before we ever push on them, to make an adjustment. And that's the big difference between what we do and what most of the other profession does. Because sadly, most places, they don't even check people anymore. They just lay them down and they do a random 7-area manipulation, just kind of popping and praying type of thing. But in Gonstead, we do x-rays on everybody we can, and we check them just like we're doing now every single visit. And we will not adjust unless we find damaged joints causing nerve irritation. And when we correct them, we have a full spine x-ray that tells us exactly how to correct things. We don't just blindly push on bones hoping that we did it right. We want to know absolutely for sure, and that allows us to get a lot of these good results that we get.
Yeah. The other thing I had was my jaw. I dislocated it several years ago, and it came out of place again. So Dr. Waller here put it back into place, and the jaw pain is gone. So
yeah, we do a lot of things. People don't really associate a lot of what she's here for with chiropractic, like jaw pain or constipation. But with what we do, we're really not treating any of those. It's not a treatment specifically for any condition. What we simply do is we find out why the body's not working right in the first place. And that's usually because of the brain signals trying to get to the body just aren't getting there because of the spinal damage. And we simply go in, find out where it is, specifically correct it, and let the body go back to working the way it should. And she's done really good. We've got just about everything she came with completely gone. She's dealing with a little bit of minor elbow stuff, but she's doing great. And then once we get it under control, hopefully she'll stay in her maintenance care. We can keep it gone. So I've already checked her again, just like we did. I found a few nerve pressures that we're going to adjust for her today. So we'll start with the neck. Go ahead and sit back for me. All right. And we adjusted in the chair because biomechanically this is the best way to do it. And we can do it face down for those who maybe don't like it in the chair, or sometimes people are scared of being adjusted, but everything we do is safer than taking aspirin. So we're going to just specifically make a contact on this vertebra. We're just going to set it up nice and easy. That was great. Okay. Now I'm going to get you over here for these other two.
Okay.
We've got a couple more segments we're going to do. Going down. I've got one in her mid back, and I'm actually going to work on her low back here. We can adjust the low back on the pelvic bench, which is one of the ideal places to do it, but sometimes we can choose to do it here. It's really just doctor preference, or sometimes the patient can't go on their side, so we have to do it here. But it's just as specific, and it gets the job done. That's good. All right, I got one in her mid back. Come over here this time. We're adjusting it according to the listing, so you see me switch sides. It's because the x-ray tells me exactly how it needs to be adjusted. Let your shoulders down just a little bit there. Great. That's easy. Perfect. Good. All right. Come on. All right. And when I get back in the chair, I'm simply going to check motion again to make sure it's moving better. Sometimes we hear noise, but noise really doesn't mean anything. People get too hung up on what they hear. Noise just means a little bit of gas is released. So I'm going to check her again. And that motion's a lot better. Okay, so before we let's check the bottom. Very good. All right, guys, well, thanks for another business again. Come back and join us. Bye-bye.